Hello, dear friends. This is Sofya Dorinskaya with you. I am a psychiatrist and the head of the Center for Medical Information. Today, I would like to continue our discussion about Gilbert's syndrome and the prescription of phenobarbital. I've received comments saying that, for example, my relative, father, uncle, mother, has this elevated bilirubin. They've been diagnosed with Gilbert's syndrome and they're being given Corvalol. And indeed, their bilirubin level decreases. So it seems like this is a wonderful treatment. Let's clarify one simple thing here. Gilbert's syndrome was described in 1900 to 1901. Phenobarbital was discovered in 1904. Yes, what does phenobarbital do? As a substance, it binds free bilirubin, and when a person takes it, the level of bilirubin in the blood drops. But the situation is that phenobarbital itself destroys liver cells and leads a person to serious liver disease, which this disease will increase both the amount of bilirubin and the levels of ALT, AST in the blood and so on. But in this case, we're simply leading the person toward liver disease. It's impossible to say that this is a treatment because you understand yourself. If Gilbert's syndrome is considered a genetic disease and a person constantly has elevated bilirubin levels, then, as some people have written to me, they take a few drops of phenobarbital for 10 days every 6 months, but this simply doesn't stand up to any criticism. So what does he do for the next 6 months after that? In other words, for 6 months the person lives with high bilirubin and then for 10 days it's lowered. Well, so what's the point? Why are you giving a person a hepatotoxic substance? So that later on, after some time, the person will already, well, it's been proven, develop liver damage. And to say that this is some kind of modern idea is completely incorrect. This is from the beginning of the 20th century, the 1900s. If we recall vitamins were discovered much later. And the science of vitaminology only really began to develop by the middle of the 20th century. But then it developed for about 2 or even 3 decades. Then apparently the successes were so great that now it has been completely eliminated. And I'll tell you more, even the books have been removed from libraries. That is, well, it's impossible to find this information anymore. So I collect them, republish them, and in this way we are bringing this knowledge back. Now then, let's get back to Gilbert's syndrome. We had a case just recently. Also a person, our client, went to the doctor and there it was, Gilbert's syndrome, and of course he doesn't want to take this phenobarbital. But he wrote me a very interesting observation. When he started taking choleretic agents, his blood bilirubin level decreased. And what did I find? I'm always looking for an answer. An internal medicine manual, an old Soviet manual. Let me say it again. Gilbert's syndrome didn't just appear yesterday. So what do we read here in the section Chronic Hepatitis and Cirrhosis? Jaundice and Gilbert's syndrome does not respond to treatment. Choleretic agents and duodenal intubation are ineffective. It's just a tiny note, literally, I don't know, less than 10 words here. And here it immediately becomes clear that if you take choleretic agents and your blood bilirubin level decreases, then you do not have Gilbert's syndrome. So what is it then? Let's take a look at what differential diagnoses are considered for Gilbert's syndrome. It is differentiated from post-hepatic bilirubinemia. That is, it is quite possible that you may have elevated bilirubin after having had hepatitis. You might say, but how? I didn't have any obvious symptoms. But if we look at the clinical presentation of hepatitis, we'll see that there are mild or subclinical forms of hepatitis. Moreover, there are forms of hepatitis where the increase in liver transaminases, those AST and ALT levels, which specifically indicate that liver cells are being destroyed, well, these indicators are elevated in the blood in 65% of hepatitis cases, but in 30%, that means that in 30 to 35% of cases, if a person has hepatitis and goes to get a blood test, these enzymes will be within the normal range. But the person still has hepatitis, and the doctor can easily miss it, and the person might go through a mild form of hepatitis without even realizing it. You might ask, how is that possible? Well, first of all, these forms have been described, these mild or subclinical forms. Secondly, nowadays people consume such a large number of pills, people are taking so many pharmaceuticals that changes in the clinical picture and the blurring of clear clinical symptoms are, in principle, to be expected. Therefore, my dear viewers, if you have been diagnosed with Gilbert's syndrome and you are living under the Damocles sword of having to take phenobarbital, although I should note, in this old book here, there is no mention of phenobarbital at all, because people understood that it would simply destroy a person's liver. And here, it's simply a diet, preferably dairy and plant-based, since fats are sometimes poorly tolerated due to accompanying biliary dyskinesia. Sometimes it's present, sometimes it's not, right? Here, it's just some kind of diet, and basically, the emphasis is on simply explaining to the person what their condition is. That's all there is to it. No problems at all. That's it. So it says here that in general there are no particular clinical symptoms. So if your bilirubin level decreases after taking cholinergic agents, then you do not have Gilbert's syndrome. This means that most likely you had hepatitis without realizing it, and you probably have post-hepatic hyperbilirubinemia, and your liver should be treated by a competent hepatologist. That is, I always recommend looking for doctors with a Soviet education, even if they've been dismissed. I hope that as individuals, as people, they still exist somewhere. Maybe you can find them through advertisements or in private clinics or somewhere. These people must still be around somewhere. That's it. And there's also another group here, functional hyperbilirubinemias. But this kind of differential diagnosis is done by the doctor on site. So I'm not going to give you a huge lecture on hepatitis right now. So what can I recommend to you specifically in terms of vitamins, since this is our area, as a way to support your health? As mentioned before, infections deplete vitamin C in the human body. Also, remember that vitamin C is not naturally produced by the body itself, so we must get it from our diet to stay healthy. Oh, I apologize. Vitamin C is neither naturally synthesized nor produced within the human body, and the absolute only way, the primary method for a person to get vitamin C, is to consistently obtain it through various external dietary sources and supplements. So what do the Lepskys write to us? In recent years, it has also been established that many pathological processes are associated with an increased consumption of vitamin C, since it turns out that all infectious diseases, both acute and chronic, are linked to significant expenditures of vitamin C. Therefore, if you have reason to suspect or believe that you might have post-hepatic hyperbilirubinemia, this means that it is highly recommended that you consider taking significantly increased doses of the supplement vitamin C. That is approximately about 300 to 400 milligrams per day. So this would be my primary professional recommendation to you for your current situation. And as for people who truly suffer from genuine Gilbert's syndrome, no phenobarbital or anything like that, honestly I don't even know what to call it. It's just some kind of semblance of medicine. The right approach is to choose the right diet, to lead an active lifestyle, and to make sure you don't have any pathology of the bile ducts, right? That is, your gallbladder should be in good condition, and that's it. And in general, learn to live with your medical condition, deeply understanding its nuances, being fully aware of it, and carefully taking your state into account when you plan and organize your daily life. I hope this message was useful to you, and I sincerely hope that I have protected many people from taking completely unnecessary and harmful phenobarbital. This was Sofya Dorinskaya with you. All the best. Goodbye.